Hello friends, in previous video I asked you two questions regarding anticholinesterase drugs. First question was that why anticholinesterase drugs are contraindicated in hypotension. Answer of this question is very simple, that anticholinesterase drugs are going to produce the vasodilatation, and because of this vasodilatation we get the decrease in total peripheral resistance, and because of this decrease in total peripheral resistance, again we get the more marked hypotension in hypotensive subjects. Because of this, my dear friends, anticholinesterase drugs are contraindicated in hypotensive patient. Second question was that why anticholinesterase drugs require the caution for using them in a hypertensive subjects. Here there are the multiple reasons. Many of you have given the correct answers, but one more important thing that many of you have forgotten, that I am going to tell you in this video at last. So coming back to the why anticholinesterase drugs require the caution while using them in a hypertensive subject. First reason is that anticholinesterase drugs are going to stimulate the ganglia, and because of stimulation of the ganglias we may get the release of noradrenaline as well as the adrenaline, and this noradrenaline and adrenaline is going to increase the cardiac activities. Ultimately it results into the hypertension. Also, those drugs which are going to cross the blood-brain barrier, such anticholinesterase drugs are going to produce the central effects also, and because of that also we get the rise in blood pressure. In case of hypertensive subject, using the anticholinesterase drugs increases the risk of cerebral hemorrhage also. Because of this also there is a requirement of caution while using the anticholinesterase drugs in hypertensive subjects. And the last thing that many of you have missed, that I am going to tell you now. As all of we know that, dear friends, this is a condition of hypertension, and in case of hypertension there might be a damage of endothelial cells which are present on the blood vessels, and whenever there is a damage of the endothelial cells, at that time anticholinesterase drugs or the acetylcholine is not going to stimulate the M3 receptors which are present on the endothelial cells, because here endothelial cell get damaged, so we will not get the stimulation of these M3 receptors, and we will not get the release of EDRF or nitric oxide through these endothelial cells, because there is the absence or there is a damage to the endothelial cells. So nitric oxide is not going to be synthesized and we will not get the vasodilatation. But instead of this, now these anticholinesterase drugs, whatever they have released the acetylcholine, this acetylcholine is going to directly act on the vascular smooth muscles through the M3 receptors, and because of this we get the vasoconstriction. So this is also an important reason why there is a requirement of caution while using the anticholinesterase drugs in hypertensive subjects.